Today I'm going to be demonstrating how to do Bitewings on my friend Gilbert here. We're going to be taking Bitewing x-rays of his molars and his premolars. So, how do we place the sensor? So these are Gilbert's teeth right here. So in order to get your molars, you always want to make sure to place the sensor on the molars, and you want to be distal to their second premolar. And then when taking a shot of their premolars, you always want to be on their premolars and you want to be distal to the canine. So, for example, I have my sensor here and I have Gilbert's teeth here. So you want to make sure to put the sensor in their mouth, and you always want them to bite down shut. You don't want them to bite down too hard that it hurts them, but you also want to make sure that they're biting down hard enough so the sensor doesn't move. So when they bite down on the sensor, you'll want them, a good technique to use is to have them smile. When they smile, you can see the teeth that you're looking at. On this side with the sensor, you can always see the teeth to make sure that you're getting the right angle that you need. As well, when you move it to take a picture of your premolars, you also just move the sensor up forward just a little bit so you can get those premolars and you can get that canine as well. So the good techniques that you can use for getting shots of their molars and premolars, like I said earlier, you can have them bite down and you can have them smile. You always want them to look straight ahead, and you never want them to move. You want them to be very, very, very still. So when positioning the tube head, you always want the tube head to be parallel to their cheek. So whatever side that you're taking the picture on, you always want it to be parallel. In order to see that you're getting the perfect angle, our PID has a little line on it that will show if you are parallel to the cheek. You always want the occlusal surfaces to be horizontal, and you want to make sure that you have a good line to see the images that you're taking. So like I said earlier, for example, if we're taking a picture of our molars, you want to make sure that the PID and the tube head is placed right on their molar, where their molars would be on their cheek. And then when it's time to take pictures of their premolars, you just want to go ahead and move the tube head just a little bit more forward, so then you see those premolars and you see that canine as well in the picture. When it comes to taking pictures or Bitewings of the other side, the concept is the same. You want to go ahead and you would move the side of the tube head behind them, and you would take a picture of their molars on this side, and then you would also take pictures of their premolars on this side. You want them to bite down gently, but not gently enough that it'll move, like stated earlier, and you should have pretty good pictures to go. It is very important to get a picture on the very first try, because you don't want to have excessive radiation that could harm our patient. So these techniques like smiling and being able to see the teeth before you take the radiograph is a great technique. Also, which having them occlude on the sensor, not hard, but just hard enough so the sensor doesn't move, is also good. And also making sure that they're very still and looking straight ahead. Those are some good techniques in order to get the perfect Bitewing image.